I want to talk about something that's come up more than once, both professionally and personally. About 3 years ago, when I told a family member that I was starting a GLP-1 weight loss medication, she looked at me differently and made a comment about how upset she was that people were now using diabetes medications for weight loss. Now, I didn't think she was mad at me or upset with me, but she was disturbed by the situation. She has diabetes, she needed her medication at the time, and she was struggling to get it. And instead of stirring that boiling pot too much, I took the L in that conversation. I didn't argue back, because I realized her frustration wasn't really about weight loss shots. And later, she finally communicated that her frustration was about having adequate access to the medication she needed every day to manage her diabetes. And that moment has stayed with me over the years because it reflected conversations I had already been hearing in the emergency room long before social media got loud about people taking weight loss medications that diabetics rely on. So today, we're going to talk about people with diabetes and what they're saying about GLP-1 weight loss medications and how we can approach this conversation with more clarity, compassion, and accuracy. And just a note before we begin, this conversation is for education and understanding. It is not medical advice, and it is not about blame. My name is Dr. Kisha Pickford, and I'm a nurse practitioner and a holistic nutrition weight loss coach. I've worked in emergency rooms for several years, caring for people with diabetes and the complications that come along with this condition. I also personally take GLP-1 weight loss medications, so I understand this conversation from multiple angles. And this is Weight Talk Thursdays, where we keep it heart-centered, hormone-friendly, and real-life approved. Now, let me say this clearly first. The frustration coming from people living with diabetes is valid, especially when someone depends on a medication daily to manage blood sugar and prevent complications, hospitalizations, and long-term damage to their health. Access to medications like GLP-1s matters. And early on, when demand surged and manufacturers couldn't keep up, people felt scared. They felt overlooked, and they felt like their needs were being pushed aside. I saw this working in the emergency department. It looked like patients coming in with uncontrolled blood sugars, people rationing medication or taking lower doses to make it last, and people genuinely worried about what they would do or what would happen if they couldn't get what their body needed. But here's where the conversation sometimes gets cloudy. The frustration isn't actually about people using GLP-1 medications for weight loss. It's about system-level issues, supply chain delays, insurance coverage decisions, manufacturing limits, and health care access inequities. And it's important for all of us to understand that these challenges are not created by individual patients trying to care for their health, whether that's blood sugar control, weight loss, or weight management. The key point here is this. Blaming patients for systemic problems does not fix access. It only creates division. And it's also important to understand this. GLP-1 medications were not developed only for diabetes. They target metabolic pathways involved in blood sugar regulation, insulin resistance, and appetite signaling. That's why they're now used for multiple medical indications, including obesity, which itself is a chronic disease. Now, that family conversation I mentioned earlier was eye-opening for me because it reminded me that two things can be true at the same time. Someone can be frustrated about access to diabetes medication, and another person can be appropriately using that same medication as part of a weight loss or metabolic treatment plan. These two truths do not cancel each other. What we don't always see is that many people using GLP-1 medications for weight loss are also managing insulin resistance, prediabetes, metabolic syndrome, or long-standing weight cycling issues, and preventing progression to type 2 diabetes is not irresponsible. It's proactive care. And the good news is that overall supply has definitely improved. Manufacturing has expanded. Distribution has stabilized. And many of the shortages we saw early on are less severe today. But that doesn't mean questions are gone away. And it doesn't mean access is perfect. What it does mean is that the conversation needs to evolve from blame to understanding. And this is exactly why education matters more than outrage. When we understand how these medications work and who they're appropriate for, we can move away from judgment and toward informed decisions. And when partnering with me at Ample Health and Wellness, some women start by reading my book, The Wait is Over, to understand how metabolism, hormones, and weight change after 40. Others choose my on-demand masterclass for a deeper breakdown of sustainable weight loss and a long-term strategy. And for women who want guidance and accountability, that's where committing to my Fresh Start Holistic Weight Loss Program comes into play. Now, you can explore all three options at amplehealthandwellness.com, and there's no specific order to go in. Support looks different for everyone, and that's okay. But before we wrap up here, I want to leave you with a reflection for the week. When you have noticed frustration around access or healthcare access, how might changing the tone of that conversation create more compassion? How can you do that? If you're comfortable, I want you to come back here and drop one thought in the comments about how you can do this. And this is a safe space for learning and not arguing. If you're living with diabetes and have felt unheard or frustrated, your voice matters. And if you're using a GLP-1 medication for weight loss or metabolic health, your care matters too. In upcoming Weight Talk Thursdays, we'll continue talking about real-life GLP-1 use, what really happens behind the scenes, and how to protect your health long term. Well, that's all I have for this episode. Thank you for joining me today. And remember, your health is not a secret, it's your story. So own it. Until next time, please stay healthy and most definitely be safe. Bye.